Hey, so it's 10 o'clock in Trinidad and Tobago in the Caribbean. So I would like to officially start our 7th webinar of the IDR Caribbean section. My name is Rosnah Binti, and I'm affiliated with the University of the West Indies, and I'm the current Vice President of the IDR Caribbean section. This morning, we have a webinar in which we would like to share the highlights of our research from the University of the West Indies, St. Augustine, with you all. And we have our professor from Malaysia, Professor Zain, who is joining us, and she will be sharing some insights as well. Firstly, I would like to bring a message from our president of the IDR Caribbean section. So this is from Professor Santosh. And he says, "Dear members and distinguished guests, it is with great pleasure and honor that Office of IDR Caribbean Section welcomes you to the International Association for Dental Research, IDR, Caribbean Section's inaugural webinar series. Research highlights from the Caribbean universities. As the president of the IDR Caribbean section, I'm delighted to extend a warm invitation to each of you to partake in this exciting event. Our mission has always been to celebrate the excellence and dedication of dental researchers and educators across the Caribbean. This webinar series will serve as a platform to recognize and applaud the remarkable achievements for our colleagues. Through this initiative, we aim to achieve multiple goals. Firstly, we seek to showcase the outstanding research endeavors conducted by dental schools and universities across the Caribbean. We firmly believe that highlighting these accomplishments is not only a testament to the talent and innovation in our region, but also an opportunity to inspire further research excellence. Secondly, we are committed to fostering collaboration and knowledge exchange. Research knows no boundaries, and by connecting with one another, we can explore novel ways to address oral health challenges specific to our region. This event provides a forum for us to come together, share ideas, and build new research networks that will propel our collective work forward. The IDR Caribbean section has always valued the importance of community and collaboration. Our long-standing commitment to excellence in dental research is mirrored by our dedication to networking and strengthening our ties within the IDR community. By participating in this webinar series, you contribute to the growth and enrichment of our research networks. I would like to extend my sincere gratitude to Prof. Rosnah Binti Mohd Zain for accepting our invitation and joining our Research Highlights webinar series at the level of Guest of Honor. I also express sincere thanks to dental school partners, presenters, and all those who have worked diligently to make this event possible. Your dedication to the field of dental research is truly commendable. In closing, I would like to reiterate my warmest welcome to each of you. This webinar series is not just a celebration of our accomplishments, but a promise of what we can achieve together. I look forward to the insightful discussions, knowledge sharing, and meaningful connections that will undoubtedly emerge from this endeavor. Thank you for your participation and support. Respectfully, Professor Arvind Santosh. So with that welcome message from our president, I would just like to give our attendees a short presentation of what the agenda would be. So the formats would, we would have our professor from the dental school at St. Augustine, Professor Smith, who will be the moderator, and he will introduce us to our guest of honor and our speaker today. And I would just like to remind the viewers that I'm going to share a document in the chat. It's in the chat right now. And once you fill that Google form at the end of this series, so you have to put your name in and fill a couple of questions, and afterwards you'll get a certificate. Right? And I now hand you over to Professor Smith.
Thank you, Dr. Balkaran. Good morning and good evening to Professor Zain. It is my pleasure to introduce Professor Zain, who will be our featured speaker today. So Professor Binti Zain is a professor in oral pathology and oral medicine at the Malaysian Allied Health Sciences Academy. She is also Deputy Vice-Chancellor of Research, Innovation and Enterprise, and the CEO of Research and Innovation, that company at MAHSA. She was the previous Dean of the Faculty of Dentistry for 6.5 years until May of this year. Previously, she was at the University of Malaysia for 35 years, spending 15 years in administration, including Dean of the Faculty of Dentistry, and also the founding director of the Oral Cancer Research and Coordinating Center, where she continues as advisor. She has numerous roles in service in the community. She's the past president of the Asian Science Society of Oral Pathology. She had roles in accreditation and quality, where she served at the Malaysian Quality Agency, the Ministry of Higher Education in Malaysia, and committees that oversaw the professional qualifying examinations for dentistry and specialty postgraduate programs. She also worked on evaluation and monitoring committees for research grants for the Ministry of Higher Education and the Ministry of Science and Technology in Malaysia. Her research focus is in the area of oral potentially malignant disorders and oral cancer, specifically the standardization of lesion criteria, the standard methodologies, quality control for research on oral cancer, risk factors for oral cancer, and screening and intervention for betel nut chewing. She has a clear philosophy of collaboration, having collaborated with a university in Japan to produce the first population-based prevalence data on oral cancer and oral potentially malignant disorders in Malaysia. And these collaborations with Swedish and German colleagues also developed training packages or programs, notably Oral Detect, that is currently being used widely in Jamaica. She is widely published and has consensus papers. Most notably, she is one of the experts in the upcoming Volume 19 International Agency for Research in Cancer Handbook, International Collaboration on Cancer Reporting, and the 4th and 5th editions of the WHO Classification of Head and Neck Cancers Blue Book. She has been awarded for her research efforts, being the 2014 awardee, Top Research Scientist Award, the 2016 inductee into the Search Distinguished Fellow for Asia International College of Dentists, and an honorary life member for the International Association of Oral and Maxillofacial Pathology. So we have somebody here with clear leadership and organizational skills, yet able to successfully manage and organize human resources infrastructure towards the successful completion of many projects. Now, the United Nations has 17 goals for sustainable development. Among them, number 3 is good health and well-being. Number 4 is quality education. And then number 17 is partnership. And we are indeed honored to have this speaker join the IDR Caribbean section, and we are eager to hear her presentation today entitled Sharing Experiences on Dental Research Towards Supporting the United Nations Sustainable Goals. So, friends, I give you Professor Rosnah Binti Zain.
Thank you. I think I have shared, but can't see the slides. Okay. You can see that?
Yeah,
you can see, Prof.
I'm muted. Let me see. Can you hear me?
Yes, Prof.
Okay. Okay. Thank you so much for the introduction. I am actually deeply honored that I'm invited, and I would like to thank Prof. Arvin Babu Santosh and the IADR the Caribbean for inviting me to your webinar series. It is indeed an honor, and I look forward to also listening to your presentations and discussions. I would like to start by introducing my university, which is MAHSA University. It is situated close to Kuala Lumpur City and the Kuala Lumpur International Airport. So anytime you come by, it's very near to the airport. There is a dental faculty in the MAHSA with an intake of undergraduate students of 75 to about 100 per year. And we have started a clinical postgraduate program of 1 master and a 3-year doctoral. So to be a specialist in Malaysia now, they have to go through a 4-year program. And there are a total of 13 dental schools with 6 public universities and 7 private dental schools. And I would like now to start off with this slide, which I think that was already mentioned about the Sustainable Development Goals of the United Nations with the 17 areas. And I would like, and in sharing experiences, I would like to start off with the Malaysian scene in research, and in particular dental research in general, where it started with ad hoc research, where researchers are individual working in silos, or there may be groups in silo disciplines. However, as we move on over the last 15 years, we're starting to realize that the way to go is actually to have a partnership. So there is a realization of the need to work in teams and create partnerships, thus moving into multidisciplinary research, combining the arts and sciences together with having key performance indicator to guide us as our outcomes. Initially, key performance indicators would have been just publications. And as we go on, it will be high impact publications and products, patents. But now, within the last 10 years, even our government grants are now asking more than just publications. They're asking for impact to society and the communities. Thus, the importance of the SDGs that I'm presenting now. So as was said earlier, one of the most important SDG that would be related to dentistry would be good health and well-being. And dental research plays a crucial role in advancing oral health and well-being. It also focuses on the understanding the causes and prevention of oral diseases, developing innovative treatments, and promoting oral health education and awareness. Thus, by improving access to quality dental care and addressing oral health disparities, dental research can contribute to the SDG. And just a minute. Sorry, just something's blocking my view. Okay. So in Malaysia, the Asian and global with epidemiological-based research on dental caries, periodontal disease, oral mucosal diseases, and others, where they're mainly prevalence and awareness and focusing on screening and early detection. And the research emphasis goes on into dental disease and general health. And as you, most of you are aware, we actually have the relationship of oral health promotion, the oral health care, and universal health coverage with social determinants. We talk about social determinants of economy, society, culture, and environment, and on the other, just the alcohol, betel quid, cigarettes, and sugar. And so let's move on. Sorry, I think it hangs. All right. So the next SDG is quality education, and that is actually extremely important. Also in our area, dental research supports SDG 4 by contributing to dental education and training, and research helps develop evidence-based dental curricula, educational tools, and teaching methodologies, and it enhances the knowledge and skills of dental professionals, ensuring the provision of high-quality dental care and promoting lifelong learning opportunities in the field of dentistry. And examples of research supporting SDG in this region, we embark on various teaching methods, whether innovative or modification of existing teaching and learning processes. And we also embark on various assessment methods, which are known to drive learning. And we have an association, the Southeast Asian Association for Dental Educators, where we have yearly meeting in the region where presentations on innovations in dental education are being shared. We have areas like peer-assisted learning, repetitive learning, and corrective feedback. So these are the areas that they have been working on in Malaysia, in our region. And this is what was mentioned earlier. This is an oral detect tool. It is actually a structured training method of over it started with being over 2 days, but now it's being made over 1 day, but it is filled up with repetitive assessment with discussions on corrective feedback. And we find that extremely useful. And this was actually started since when we did our epidemiological survey in 1993, and then we continue to make it more of a national training where the Ministry of Health trains all dentists using this method. We actually at Oral Cancer Research and Coordinating Center actually train the specialists who eco-train the dentists. The next SDG is about SDG 11, which is sustainable societies and communities. So how does dental research support this? This is through urban development by exploring innovative approaches to oral healthcare delivery. It can examine the effectiveness of community-based dental programs, teledentistry solutions, and preventive strategies in urban areas. By promoting sustainable oral health practices, dental research can contribute to building inclusive, safe, resilient, and sustainable cities and communities. And in our university, we actually started, but it is at the beginning, and we also plan to embark on multidisciplinary projects with research on developing smart and sustainable village. Initially, it was called Eco Village, but I think it goes beyond Eco Village. It involves incorporate usage of solar energy, green building technology, robotics and AI, and predictions in medical, dentistry, and engineering. And there is a plan on urban farming, aquaponics, and hydroponics. And this research interacts or integrates with other SDG, for example, clean water and sanitation, affordable and clean energy, and responsible consumption. So if you really see what we are trying to do is we have what we call a smart and sustainable village, and we have the engineers doing their solar energy. They have actually looked into areas. They are not the people who started it, but they have used it for the campus, solar cars. They're trying to get solar charging station, and the urban farming that I was talking about. Then there is also the medical and dental AI diagnostics, and for prediction, also possibly addressing waste materials, which is the project that I think globally is being looked into. And there is also engineering and architecture, where they are doing green building using recycled products as the bricks. And there is also an eco environment where our university is now a single-use plastic. We're trying to avoid single-use plastic. Yeah? So that is how we tackle and how dentistry gets into this SDG 11. And next is the partnership for the goals, where dental research often involves collaborations between researchers, dental professionals, policymakers, and other stakeholders. These partnerships facilitate knowledge sharing, capacity building, and the translation of research findings into policy and practice. And by fostering multi-sectoral collaborations, dental research contributes to achieving the SDG 17, which aims to strengthen global partnership for sustainable development. However, when you're trying to do partnership, how do we get effective collaboration? You need effective leadership, common visions and goals, partnership resources, membership, clear roles and responsibilities of members, organizational structure and capacity, good communication, transparency in decision-making, trust, respect, and commitment. And this is a case study of, I think it was mentioned earlier, about the Oral Cancer Research and Coordinating Center. When I was in the University of Malaya, this started around 2002, 2005. And we have a government grant, we call it a top-down, to to start this building partnership in oral cancer research. And this is a collaboration between the universities, Ministry of Health, and research NGOs. And we have a very strong research NGO, the Cancer Research, CRM, Cancer Research Malaysia. And we're banking data and tissue of oral cancer, and this gets shared by all the collaborators. And the partnerships, of course, have its ups and downs, but requires, the most important is transparency and trust among collaborators. And success in publications, innovative research in early detection, incorporating AI, biomarkers, and vaccine development. It also contributes an impact to society, as I said earlier. As we, within the last 10 years, more and more is being looked into the impact to society, whereas earlier on, we were always talking about a high impact publication. And this partnership has now been extended to oral health related research between the Asia Pacific region and globally. And there is an article that we wrote to talk about how we went through this partnership when we initiate the oral cancer biobank. And it also showed that, I think this is around 2012, from the time we actually have the biobank. In terms of research, the cumulative impact factor has accelerated over the years. The publication has increased, and this is all through the presence of the pooling of the data and tissue. However, being in partnership, there are also the areas where partnership fails in some area, but we still maintain this partnership through getting other partners, or maybe with certain areas of the partnership, but we still maintain our partnership in general. So this is just an example of the SDG partnership for goals. As I was given only 5 minutes, so I hope I've done it in 5 minutes. Dental research can have broader impacts at other SDGs. The key in dental research is to recognize the interconnectedness between oral health and the broader sustainable development agenda. So while oral health was left out of global health goals, we could all do our roles in contributing towards the success of the United Nations SDG and building a better world and sustainable future. Thank you.
Thank you very much, Professor Zain. That was a very good presentation, very enlightening for us in this part of the world where we struggle with similar issues, and we are probably in a more infantile position with regards to some of those sorts of initiatives. So thank you very much. Dr. Marchan, shall I introduce our next speaker?
Yes, please. And we'll take questions at the end for both.
Our next speaker is Dr. Shivaughn Marchan. Now, Dr. Marchan graduated from the University of the West Indies in '97, having completed her internship, and works at the university and in private practice in Trinidad. She did her postgraduate training at the Eastman Dental Institute, University College London, in conservative dentistry, and she returned to the university in 2000 as a full-time teaching position in restorative dentistry. She holds other postgraduate qualifications of higher education from the Arthur Dugoni School of Dentistry, University of the Pacific, and is currently set to graduate with a doctorate in educational leadership from the American College of Education of this year. In 2018, she was made a fellow of the Academy of Dental Facial Aesthetics. She is a core faculty member of the School of Dentistry. She teaches both preclinical and clinical courses in restorative dentistry, and an active researcher publishing with 3 themes: dental education, dental biomaterials, and in vitro clinical research on the etiology and pathophysiology of tooth surface loss. She currently serves as the chair of the Committee on Research Outreach and Special Projects at the School of Dentistry, and is on the Faculty Committee for Entrepreneurship and other management committees of the School of Dentistry. I'm very happy to introduce Dr. Shivaughn Marchan.
Professor Smith, thank you very much for that introduction. And I would like to thank the IATR section, Caribbean section, for inviting me to speak this morning. Is everybody seeing my presentation?
We can see.
You maximize it.
Hold on. Hey. So good morning, everyone. Again, thank you, Professor Smith, and thank you to the Caribbean section of the IADR. My name is Dr. Shivaughn Marchan, and currently I serve as the chair of the Research Outreach and Special Projects Committee. So just a little bit about our school. Our school was established in 1989, and it was the first dental school in the English-speaking Caribbean as part of a larger medical faculty that was envisioned by the government of the day. So the government wanted to build this tertiary hospital complex, and they envisioned the medical faculty as part of this complex where there would be training of different categories of healthcare professionals, not just medical doctors. Many of the staff at our school are former graduates, and in the late 1990s, the university saw benefit in developing the staff complement at the school if it were to ensure its sustainability. So they offered partial scholarships to many of their graduates who pursued postgraduate training in the United Kingdom. Now, our school is divided up into three main teaching units: restorative dentistry, child dental health, and oral diseases. And this came about as a result of adoption of a competency-based curriculum in 2001. So within the unit of restorative dentistry, we have the disciplines of endodontics, operative dentistry, periodontics, and fixed and removable prosthodontics. Within child dental health, we have preventive dentistry and dental public health, and pediatric dentistry and orthodontics. And in the teaching unit of oral diseases, we have oral surgery, oral pathology, oral medicine, and radiology. And if I had to sum up what research has been about at the School of Dentistry over the last 20 years, I would say that it would be a collaborative effort that has been guided by senior academics as we try to build our research capacity. So what are our research foci? Well, research is organized around the broad themes of the teaching units. So a perusal of our website will show you that the themes are public and child dental health, restorative dentistry and dental materials, oral disease and systemic health, and we have this last theme of dental education. Now, our accreditor, CAMHP, has been toying with the idea of introducing a standard in social accountability in various aspects of medical education. And if this standard is introduced to medical schools in the Caribbean, we are sure that soon it will be introduced as a standard for dental schools. So while we have these broad research themes, I feel like we may need to reflect and reevaluate on these themes to make sure that our themes are aligned to the needs of the Caribbean population. At the moment, however, UE, like any institution of higher learning, allows academic freedom in the pursuit of research endeavors. So what have our accomplishments been over the previous 5 years, and I'm only talking about the last 5 years. Well, the majority of our publications are in peer-reviewed journals, 100%. And the journals in which we publish are a mix of national, regional, and international journals. And we use both traditional and open access publishing platforms. However, for the past 5 years, if you look at our research output, you will notice that we're tending towards utilizing open access publishing to disseminate our research findings. And finally, we have been trying, or recently we've attempted to use a post-publication research platform. So F1000 provides a post-publication review. So once your paper has been accepted by the editorial team of F1000, you can then have the peer review in open. So these are just a list of some of the publications from the unit of child dental health and public health. So you would find that within these broad themes, there are foci of research across the units. So for example, in child dental health, there's several academics that have published on early childhood caries. You will also find a research foci of oral habits in children. So for example, this paper on the knowledge and attitudes and behavior towards preventive care by Ramsrup et al. Is aligned with the research foci of early childhood caries. The paper by Naidu and Nunn on the oral health knowledge, attitudes, and behavior of parents and caregivers of preschool children, again, aligned with the foci of early childhood caries. Paper by Percival et al. And Naidu also aligns with early childhood caries. Within the theme of restorative dentistry and dental materials, there are two strong foci of research. The first one is tooth surface loss. And there are published papers, both clinical and in vitro, on this phenomena of tooth surface loss. The other foci of research within this unit is dental biomaterials research. Within the theme of restorative dentistry and dental materials, there are also publications of case reports, as seen here by this paper with Ramcharan and Rafiq. It is noteworthy to note that Ramcharan is actually a part-time clinical lecturer at our school. So even our part-time faculty are involved in research. These are the papers by Rafiq et al. Case reports. Within the theme oral diseases, published case reports dominate the research output of the unit, or have dominated the research output of the unit for the past 5 years. Now, the theme of dental education is broad. Of the papers published in the last 5 years, some exclusively look at dental education and use dental students as their participants, or some of it is collaborative research that includes faculty members from the School of Dentistry, where researchers might be investigating the needs of healthcare professionals, or even researching the needs of dentists that have already graduated and are out in the private practice. Coming out of the pandemic, several researchers within the school looked at the effect of COVID-19, not only on dental education, but on the practice of dentistry. So this is just a synopsis of some of the papers that have been published over the last 5 years. So what ongoing or planned research projects do we have? Well, we are going to look at the incidence of idiopathic pulpal pathology in patients with sickle cell disease. This project will be driven by the endodontist in our restorative unit in collaboration with faculty from the Department of Medicine within our faculty. Professor Rafiq is looking at an analysis of the microbiome of peri-implantitis and periodontitis. We're looking at water sorption and surface roughness of gingival colored restorative materials. And Dr. Aswal is planning a project on identifying factors associated with motivation in dental education. The other project on the outcomes of vital pulp therapy in permanent teeth of pediatric and adult patients is a collaborative effort across restorative dentistry and child dental health. First one listed on this slide is an upcoming second-year research project where our dental students will take the lead on the project. The first and second, sorry. Professor Rafiq and our partners in the Department of Chemistry in the Faculty of Life Sciences will be looking at the leaching of dental materials and fluoride release. And then we plan an audit into the clinical teaching of caries management and carious lesion management at the School of Dentistry. And finally, Dr. Balkaran is just concluding some research on the effect of silver diamine fluoride on the flora of the oral cavity. So who are our collaborators and our partners? Well, most of the collaboration happens within units or across units within the dental school. We also have inter-faculty collaborations. So within the medical faculty, we may collaborate with the Department of Preclinical Sciences, where there is a biochemistry unit, or the School of Pharmacy. We have also collaborated in the past with the faculties of engineering to facilitate our dental materials research, life sciences, social sciences, and humanities and education. We have collaborated with the University of Trinidad and Tobago, and they have also facilitated some of our dental materials research. And UTT has been a collaborative partner of the School of Dentistry for several years. And finally, we have the University of Edinburgh and Trinity College Dublin. And these latter two organizations were both conferred doctoral degrees for two of our staff members. What we note in our collaborations and our partnerships, however, is that individual researchers leverage relationships to facilitate research. And what we might need to be moving towards are institutional arrangements that would help facilitate collaborations and partnerships. So, is there student involvement? And the answer is absolutely yes. So our students, our dental students in their second year have to do a mandatory research project, starting in the second year and culminating in the third year. And previously, this research project was confined to only a public health research project. However, the unit that is responsible for these research projects have expanded the scope of topics that the students can investigate. So the students drive this research. It culminates in a research presentation at an annual Student Research Day. But there are other key deliverables that are coming out of this research project. They must complete a technical report where they report back either to the site that gave permission to do the research or the UWI Ethics Committee. They must present at a conference, either a national, regional, or international conference, and they must write up the research project and submit it for publication. Now, we also have teaching assistants and dental interns at our site, at our dental school, and they become involved in research when they show interest. So it really is an ad hoc relationship with our teaching assistants and our interns. And finally, lecturers can apply for an intramural grant, which is referred to as the Campus Research and Publication Fund, to fund research. And there is a mechanism where you can fund a research assistant to help you conduct your research. Any student, teaching assistant, intern, or research assistant that plays a pivotal role in the research projects normally get their name published as an author. Now, what are our ongoing projects to improve the research culture? Well, in Trinidad, we have this Caribbean Center for Health Research, Health Systems Research and Development. And the resources of this center are available to all schools and faculty members within the FMS, the Faculty of Medical Sciences. They routinely run workshops to improve the research capacity of units and individual researchers. So, for example, one of the last workshops they ran was on data size calculation. They also have a research forum, an active research forum, and one of the last forum posts was on data saturation in qualitative research. So really, the Caribbean Center for Health Systems Research is a university-wide center to help improve research output and impact. So what have been our successes? Given that all of our research output is peer-reviewed, we use typical indices to measure success. So we would use the H index for individual scholars. We can also look at the H index for a particular journal, or the impact factor of that journal, or the number of citations of your paper. And these are metrics that are actually used at the Faculty of Medical Sciences in St. Augustine for promotion and advancement. Because we are a small school, we look at grants and collaborations as a metric of success. So, for example, Professor Rafiq, who recently published a paper on the microbiome, had external collaborators out of California for this, and we would say that that is a research success. Recently, there's been a campus-wide initiative of mentoring to improve research output and impact, and this is ongoing, and we have to monitor the success of this program to see how we can tweak or improve it. What are our research challenges? Well, we are an under-resourced setting. External grants are difficult to come by because Trinidad has a status as a high-income country, so it doesn't really help with grant acquisition. The rise of predatory publication has also been a research challenge when it comes to publication. So several of our academics have actually found their published research that they've worked very hard on, on the Cabell's list and flagged as a predatory journal. And sometimes this happens months or even years after a paper has been in a journal. And finally, a big research challenge, again, because we're a small school where only 21 full-time faculty, is balancing teaching and administration with research. What we found, though, is that if we do not have a strong research ethic, if individual academics do not have a strong research ethic, other things will be prioritized in front of research. And what are the future directions? Well, the future directions center around improving the research culture. So recently we restarted a staff research forum where junior members of staff pitch ideas to senior members of staff, and we give feedback on the research methodology and other things. So this research forum, we're hoping, can improve our research culture. We want to actively introduce our interns and our teaching assistants to writing for publication, possibly starting with case reports, because we have a wealth of material, particularly in our clinics, our oral medicine and our oral pathology clinics, for writing for publication, so they can get used to academic writing. In many organizations or in many universities, the introduction of postgraduate programs drive research outputs. So we're hoping that we can have 1 or 2 postgraduate programs in the near future that will drive research within the dental school. And finally, we want to look at the dissemination of research in various forums. There's been a recent collaboration with the Trinidad and Tobago Dental Association, where we tell them about our research, we disseminate our research findings, we show them the alignment between the research findings and clinical practice. And in that way, we can also get them involved in research, maybe in the development of practice-based research teams with private practitioners, or even coming up with clinical guidelines for dentistry in the Caribbean. And finally, these are the contact details of some of our researchers at the School of Dentistry. I would invite any of you in the Caribbean section, if you would like to do collaborative research, we're open to hearing your ideas, and we look forward to hearing from you. Thank you very much.
Thank you very much, Dr. Marchan, for that very, very good summary, very thorough summary of the input into the academic arena of, I know, a small contribution from the University of the West Indies St. Augustine campus. So as I'll pass you now to Dr. Balkaran, who will conduct the question and answer session. Dr. Balkaran.
Thanks, Prof. So I just wanted to remind our audience that I've posted in the chat a link to the Google Docs if anyone would like a certificate from the IDR Caribbean section. There are a couple of questions. It's a short survey. And once you complete it accurately with your name and contact information, we can send it off to you. And at this point, I'd like to open the floor to any member who's in the audience and has any questions for either Professor Zain or Dr. Marchan. You can either type your questions or you can just go ahead. First, I'm seeing in the chat that we're commending the presentations so far. But if anyone has any questions.
I have a question for Professor Zain, if she's... Prof,
Yeah.
are you right? Prof, what are some of the challenges you had setting up these partnerships when you first started reaching out to these various government and other universities?
Yes, there is definitely a lot of challenges. It was not so difficult with the universities. We started with just two University Science Malaysia and ourselves. Then we added the University Kebangsaan Malaysia. With the Ministry of Health, we selected about 7 hospitals. And when we started, they actually agreed. And we went through some kind of ethics and all that. But at that time, the ethics committee is not so well set up. Yeah? But as of within the last 3 years or so, when they start expanding their own setup, then they said, we are not going to join you anymore. And so that's what I mean by we lost some partnership. Although with the ministry, the aspect of data and tissue is what we lost, but we still collaborate in terms of other research. So, and as I was mentioning, the training programs. Now, the other issue was we had a very strong Cancer Research Malaysia. And at that time, we were strong in the clinical and pathology. They were strong in the science. And there is a little tug of war with them. While it is a love-hate relationship, you know, we try and work together, and yet there is this thing that I think I'm doing this and you're not. But in the end, that's where we talk about transparency, we talk about trust, and we go and discuss and talked about all our differences, and things were okay. Now, the next group that was difficult to tackle because we were banking head and neck cancers. I mean, no, oral cancer, but it involves including the surgical material from the head and neck, and that will involve the people who are non-dental. They are the ENT, the plastic, the oncologists. And in the earlier days, those were great. But as it goes on later, it is not so much the research, but it is more competition between the specialists, the oral max spec and things like that. So that, but as I said, while we lose some, we already have a body of material. So then we continue with just our university, but we have all the expertise. So the collaboration now will be more consultation and the expertise with that. And with a strong Cancer Research Malaysia, they are the ones into vaccine. And actually, they are the ones also going into things like AI for oral cancer or OPMD detection and things like that. And they work with us, but I think they move faster because they are a research organization. Our challenges is we are a university, and we are teaching, we are admin, we are doing everything else. But when you team up with them, I think things move faster. So that's the real advantage of partnership. Yeah.
Sorry, I was muted. My follow-up question to that was, how does your government in Malaysia view dentistry? In Trinidad, I could give you an example from here. Dentistry tends to be very low on the list of priorities for allocation of funds and so on, even for population treatment. Yeah. And they have not really identified funding for research exclusively for the medical sciences or for dentistry. So I was just curious, how does the Malaysian government view dentistry in their budgets and so on?
They see dentistry as almost equal as medicine. And our strength is the fact that in the Ministry of Health Malaysia, we have an oral health promotion unit, or last time they call it dental division. In fact, we are better off than some areas of medicine. Because we have one area where the top person is at the same level as the top person in medicine, and they are always fighting for us. So I think that was why we are okay in terms of service, but in terms of research, I think it is an open system. We have two types of government grant. One is the fundamental research. One is the technical research from Ministry of Science and Technology. The other one is Ministry of Education. So that is the advantage, where they're not looking at, yes, earlier dentistry could not get much of the grants, but now they're looking at it in general. Everybody has the same opportunity. As long as you submit a good application, you stand a chance to get.
Thank you.
Thanks for that question and answer. We have another one in the chat. Dr. Valerie McKenzie is asking, what happens when one publishes and the work is widely cited, only to find out sometime later that it's a predatory journal? Can they resubmit to another journal? How do we deal with such an issue?
So, yes, so this has happened to several of our academics at our school. Unfortunately, nothing really happens. I've actually written off to some of these journals and I've said, you have now made it onto Cabell's list. You're listed as a predatory publication. Is there anything that you can do to improve your status, to get you off the list? You know, and nothing happens. So really, it is looked at. It's not good when your publication makes it onto a predatory journal. Even though Google used the calculation of your H index is not affected if the article keeps being cited.
Yeah. This is actually a big problem that a lot of universities are struggling with, especially when it comes to assessing staff members' CVs, and it will only get worse, I would imagine, given the proliferation and the opportunistic nature of some of these organizations that simply are public, they are predatory, or they are vanity journals. We suspect, but cannot prove, that there are algorithms built into these organizations that will actually generate false citations. And my colleague, Dr. Marchan, has actually experienced this, that she actually found an article that was citing one of her publications, and the article had nothing to do with the publication that was being cited. So it's a very, very difficult area to navigate. And you would have signed some sort of copyright agreement when you would have submitted and gotten accepted to publish in these journals. So there's very little you could do, as Dr. Marchan said. However, is what suffers. And if you are looking to have your work recognized in some way, it might be useful if you could find some sort of senior academic of some repute to probably write some statements on the work that you've done. And you could submit that and see if that would be any of assistance to you. But as Dr. Marchan said, there's very little you could do, and you just have to look out for it and be very, very vigilant on predatory and vanity journals.
Can I just add to Dr. McKenzie, do your due diligence before you select a journal. But that sometimes is not enough. So, for example, I had one paper that made it onto a journal on Cabell's list 6 years later. So 6 years after it had been published in this journal, the journal made it onto Cabell's list. So before you publish, look at Cabell's blacklist And also make sure that the journal is listed in Ulrichs.